The Food and Drug Administration has issued warnings about a potentially addictive dietary supplement that's widely available in the U.S. Ali Rogan has the latest.
The FDA is asking Americans not to purchase or use any products from the supplemental brand Neptune's Fix. It contains a substance called tianeptine. Some countries have approved the drug to treat depression and anxiety. It's unapproved in the U.S., but readily available on store shelves and online. It's been nicknamed gas station heroin, and it can be highly addictive. An uptick in use has led the FDA to issue several warnings about tianeptine and its potential side effects, including seizures, loss of consciousness, and death. Dr. Peter Cohen is an associate professor of medicine at Harvard Medical School and joins me now. Thank you so much, Dr. Cohen. Can you explain exactly what tianeptine is?
Sure, Ali. Tianeptine is a pharmaceutical drug originally produced in Europe as an antidepressant. Unfortunately, at higher levels, it can be addictive, and for that reason, has not gotten widespread use. It has never been approved for use for any medical reason in the United States.
If it has not been approved for use, how is it that it can be sold in the United States?
So what we see as a common and sadly tragic pattern is that many companies take foreign drugs and introduce them directly to consumers in the United States by selling them as if they are dietary supplements. And they just appear on the market and start selling them to consumers.
We spoke earlier to two health professionals who have seen patients who have been using tianeptine, and I want to play some of what they told us.
These patients definitely have increased heart rates, they're very agitated, and they will admit that they use a lot of the product. So in other words, that they're using it very routinely, that they've built up such a high tolerance to it and a craving for it that that they'll go to great lengths to get it. The presentation of the withdrawal is going to be very similar to somebody who would potentially be going through oxycodone withdrawal, heroin withdrawal.
We were putting a fair number of people actually in our intensive care units. And we had to put them in there just because they were becoming so agitated, so confused. There was concerns for heart problems, concerns for people having seizures. And so while some people, like with many withdrawal patterns, may just feel a little bit uncomfortable, a fair number of people get very, very ill and require very close monitoring with it.
You heard that last doctor say a fair number of people that he's seeing. Do we have a sense of just how big this problem is with this substance?
Yeah, it's really ticked up over the last decade. So back before 2015, we had never heard of tianeptine here. And poison control calls, reports to the FDA, very serious ones like that were described, from seizures to stopping breathing to the point of intubation and deaths, have all been reported, and they're coming in more frequently.
The FDA has issued several warnings over the past 6 years, and we should also note here that Neptune's Fix has agreed to a voluntary recall. But are warnings all that the FDA can do? Why are their hands seemingly so tied?
Right. So there's two problems here. One is how it got on the market in the first place, and that's because there's no need for companies to vet products that they sell as dietary supplements with the FDA before they're being sold. That's a major problem and would require a change to the law. But there's a second major problem here, which is that the FDA has been aware of tianeptine being imported into the United States since 2015. That's been 9 years. And like you mentioned, it was in 2018 when they first warned about tianeptine. So the fact that it's been many years since the FDA was aware of the risks and has done nothing other than issue warnings to consumers and to the company is frankly embarrassing, as they're neglecting their responsibility to protect the public from dangerous dietary supplements.
Does this represent negligence on the part of the FDA, or is this simply how the regulatory framework has been constructed and has existed for so long?
So the fact that tianeptine is sold in the United States in the first place back in 2018, there's no negligence on the FDA's part. That's how the situation is structured, our regulatory framework is structured. However, the fact that it's still sold today and that people are still dying and ending up in intensive care units due to tianeptine falls completely on the FDA not doing their part, ensuring that the dangerous supplements are removed from the marketplace.
Several states have already taken the steps of banning tianeptine. Do we expect other states to go in that direction?
Unfortunately, with the FDA not moving definitively as they need to, and they could, the states are left to fend for themselves, to protect their own citizens against dangerous dietary supplements such as tianeptine. So I would expect more states to move aggressively against these products.
Is there a role that Congress could play in addressing this?
So Congress could have two very impactful roles. Number one, they could ask the FDA to enforce the law. And that is when there's dangerous dietary supplements that they're removed from store shelves, and the FDA uses all their enforcement potential, including mandatory recalls, to do that job. The second thing they would need to do, though, if we're going to protect consumers from the next tianeptine down the road, is reform the law so that the FDA can at least ensure that products that are introduced into the United States as dietary supplements are not foreign dangerous drugs.
There are other dietary supplements out there that also are not regulated by the FDA or approved. Kratom, Phenibut among them. What are your concerns about those substances?
Right. So Kratom and Phenibut are two other drugs that are sold as dietary supplements but shouldn't be. And the FDA is not doing enough to get those products off store shelves. We've actually done a study of Phenibut where we looked at what happened to brands of Phenibut before and after FDA warnings. Well, we found that dosages of the Phenibut actually increased in the products after FDA warnings. So the FDA's actions are inadequate to date, and they need to do a lot more because it's not just these three products, tianeptine, Kratom, Phenibut, but more than a dozen other foreign drugs that are being sold currently as dietary supplements in the United States.
Dr. Peter Cohen, Associate Professor of Medicine at Harvard Medical School, thank you so much for joining us.
My pleasure, Ali.